Good morning, everybody. Welcome to Dr. Tom's Tips Case of the Week. By the way, May the 4th be with you.
Oh, that was bad.
Really bad. Really
Cinco de
bad.
Mayo, let's postpone this for a day. We'll have margaritas and do Cinco de Mayo.
Awesome.
Okay.
So, hey, today, the focus of our Case of the Week has to do with sedation. We all know the biggest problem that clinicians face in sedated patients is the potential for them to potentially swallow, aspirate things down their throat because they're out. Dr. Hirsch is going to share with us some tips around how to do that. Good morning, Dr. Hirsch. How the heck are you?
Rolando, good morning, and good morning, everybody. This is going to be one of those I hate when that happens days. So just a precursor on this one. This was a full mouth reconstruction that I did, and the patient was extremely nervous. We had to sedate her for the preps. We had to sedate her for the cementation. And so I cemented this case on Monday. And if you go to let's go to the video. We cemented this case on Monday, and I was subocclusal. I was subocclusal on those 3 crowns right there. So what I decided to do was put them in the oven and bake them. And I melted 3 crowns on a full mouth reconstruction. And that just doesn't fly. So anyway, fortunately, we had CAD/CAM dentistry, and we were able to go ahead and take new images and make them and get her back in the next day. So what we're doing here is we're doing the final cementation of those crowns on 18, 19, 20. No, it was 19, 20, 21. We're doing the final cementation there. A day later, and fortunately, she was really understanding. So we want to make this really simple and easy. As you can see, she's got this monstrous tongue. I mean, she's got the big frickin' tongue like you can't even believe. So that's in my way. We put the Optrogate in there. Now, there's a lot of discussion about whether or not you can use other modes of isolation with the Isolite or other modes of isolation with the Optrogate. And of course you can. She's out. She's not moving. So we've got the Optrogate in there. We've got her on oxygen. Now we're getting the Isolite in there. To isolate this whole area. We turn the light on, and you're going to see when we take the crowns off. This was 2 days later after retracting the tissue. Your tissue looks like hamburger over there. I mean, this is a day later, and it's really irritated and kind of scrungy looking, but just the same, we did this. So you can see as we're in here, we've got Optrogate isolation, we've got Isolite isolation, and we still need a little bit more isolation. We're trying in the crowns right now. And the important thing here in doing all of this is we want to make certain that our patients are safe. So right here with the Isolite and the Optrogate, everything is really safe. We've tried it in, took the Isolite out, but now what we're doing is we're putting a sponge in there too. So now we've got the Optrogate, we've got the sponge. Look at that tongue, it's huge. There's no way you could work around that. So you got the Optrogate, protecting her throat. We're managing her airway. If she was not IV sedated, we'd be scavenging the nitrous too, and we'll talk about that in a few minutes. Now we've got the Isolite in there, and it's still a tight squeeze. And so now I need some more room on the lingual. So let's get some more working room. Push it back a tooth, gives us a little bit more working room. Stick a cotton roll in there. We're using just everything that we can at our fingertips right now. So we've got that tooth. We've got them etched. We've primed them. We've bonded them. I'm getting ready for the cementation. We cut out that whole part of it. We've got these 3 crowns all cemented and ready, loaded with cement, ready to go. And we pop them in one at a time, and there we go. So key point here, I don't have to worry about contamination of the field. It's bonded and it's dry. There's no salivary contamination. That's number 1. I'm working in a dry, isolated field. Number 2, the airway is protected. Nothing's going to go down the throat. So little bits of cement that I flick off are just going to be safe to get off. So that's number 2. The tongue's out of the way, which makes my life really easy. And you know what else is nice? What's my DA doing right now? She's doing everything to keep everything ready, but she's not in the mouth, and she doesn't have to be evacuating and aspirating debris because it's all being taken care of by the Isolite. So that's just a real nice situation that worked out quite nicely here. So we can floss these things. put our glycerin on for the oxygen inhibitor layer, cure it all. And it made a situation that was disastrous on Monday very workable on Tuesday. So we get to thank our CAD/CAM dentistry. We get to thank the patient or the anesthesiologist. He was nice enough to get back the next day. It all worked out quite nicely.
And who's your anesthesiologist?
What's that?
Who's your anesthesiologist?
Oh, Andy Chen.
Dr. Chen, very good.
Dr. Chen worked on this case with me. And so I've got a couple. There's Mark Torbner, there's Andy Chen. So they're really good anesthesiologists. We floss it and just see everything is safe, convenient. You can see the cotton roll. You can see the Isolite evacuating the system. But what you don't see my assistant in the mouth. She's a step ahead of me. She's getting everything prepared, everything bonded, loading the crowns with cement. She's managing everything outside the mouth. They just don't need her inside the mouth. So this turned out to be a nice case. This crowns actually turned out a little bit whiter than I desired, but that was the compromise that I had to take on this one. Yeah, look, we're pulling everything out. Optrogate, little tiny piece of debris on her tongue. Optrogate's out, the sponge is out, the cotton rolls out, and there you have it. We took our little marbles from the very beginning, and God, that was horrible when that happened. Did not like that day.
That is, oh my goodness, fantastic. Thank you for sharing with that. You mentioned something about nitrous oxide. What were you going to?
So there was a study, the AAPD, the American Academy of Pediatric Dentistry, did this study. I forget what you might know.
It was a poster. A poster that was presented there. It was a poster presented in 213 for that.
Okay.
Right.
Yeah. So what they did is they did a study on nitrous oxide scavenging. And what they found is that when you're using nitrous in conjunction with Isolite, the Isolite does a job scavenging the nitrous from inside the mouth because the patient is breathing it. And even though you may have a scavenging system with the nasal hood, you still breathe through the mouth. So this re-scavenges whatever's coming out of the mouth. So it keeps the room much less contaminated with nitrous oxide. So it's better for your assistants. It's better for you. Where to go with number one? So that was number two. And you use less nitrous too. So there's less nitrous and you get better scavenging. So it's safe for you and your staff.
Awesome. I love the case. I love how quickly. I'm sure she was thrilled with the result of that. That looks fantastic.
Well, this is a lady that flew in from out of town. So, we were on a short leash here. She had to leave. Her flight was on Thursday, and I wanted at least a couple of days to dial in her bite. So they come in from out of town. You've got to do everything you can do to make it all work out properly. And this case turned out really super nice.
Awesome. Awesome. Well, first of all, Dr. Hirsch, thank you so much. Love your case of the week. I learn a lot. I see different techniques that you're using. If folks, if you like the content that we're doing here, please share it. Please tell other people. If you want to see other things, please send us notes about what you'd like Dr. Hirsch to cover. He's got so many years of experience and he's got so many different things that he's done, and it's always a pleasure to watch your work. So thank you so much, Dr. Tom Hirsch.
Rolando, everybody, thanks. We think we managed to get this right within that 10-minute time frame. So come back. We'll have another interesting one for you next week. I don't know what it's going to be yet because I haven't filmed it yet. But whatever happens to pop up this week, we'll try and get something interesting for you.
Awesome. And
thanks, everybody, for watching.
I noticed you've got a friend sitting there watching you. Who is that? Austin? Is he a student?
Austin.
Good morning, guys.
Austin is a senior dental student at the University of Southern California, and Austin has been following me for 5 years. He was going to Pepperdine, and he came in my office and just asked if he could shadow me. He wasn't in dental school yet. This is 2 years pre-dent, and I kind of followed Austin. Let's get this thing. I kind of followed Austin through his career as far as his grades, taking the DAT, getting accepted to USC, and he's been really good about following in and just checking at everything. So right now he's a senior at USC, and he just stops by, maybe once or twice a month when time permits.
Well, I love the fact that you work with the students at USC, the fact that you're so willing to share. Thank you so much, Austin. Great to meet you. I knew we weren't going to do this, but hey. Hi.
All good, all good.
Awesome. Well, hey, thank you so much. Have a great.
And you can see Austin's much more professional than I am. He's got the hat and the whole 9 yards. I mean, hey, he's loaded for bear.
Infection control to the 9.
So, hey, May the 4th be with you, everybody. Great seeing you. Thanks for joining us. Have a great week. Have a safe week, and we'll see you next week.
Okay, gang. Thanks a
Perfect.
lot.
Thank you so
Everybody have a
much.
good day. Bye-bye.
All right, bye-bye.